कोई दिक्कत नहीं
ओके तो
हाँ हाँ प्रेजेंटेशन
presentation. Okay, where is
Slideshow?
that? नहीं video थी.
अच्छा वीडियो
हाँ. Okay. Hi, I am Dr. Arif. I'm a senior consultant cardiologist at Fortis Scott Heart Institute, New Delhi. And today, on this occasion of World Heart Day, I am going to talk to you people about the heart issues, the health in general, and as we are going through this pandemic, no talk can be complete without a slight mention of the pandemic things, the COVID thing, the corona thing. So we'll be touching those things a little bit, but primarily our issue is heart. And as you can see, the topic for today is World Heart Day, 29th of September. Every year is celebrated as World Heart Day. And the aim of celebrating this particular day was to emphasize the importance of heart disease and make people aware about it so that they can take care of their heart, as it is very important. And this year the slogan that goes with this is use heart to beat heart disease, because this is very important. Use your heart to beat the heart disease and train the heart to tame the heart. So we have to do a lot of exercises to prevent, because that's one of the key things. So now the topic primarily will be heart care. And you can see this particular the whole world is shown here. And this color depiction is there, which is just to highlight the information about the presence of heart disease across the world. And if you see, more than 660, the highest percentage of people is close to our part of the world. And India also comes in a moderate category where the heart disease is quite prevalent. And if you see this part of the world, the United States of America and Canada and Australia, and including this China. So that's the part of the world where the cardiac disease is not that much in prevalence. But in India, it is quite prevalent, and there is a changing scenario constantly. Earlier, it used to be a disease of older people. Slowly, we are seeing that younger people are also getting affected. Earlier, we used to see it was more of an urban disease. It was there in big cities. Now we are seeing even the people from villages are getting it. Then another thing was that the young females, as long as their menstrual cycle is going on, they practically, people used to think they are protected. But now we have seen young females, even females who are breastfeeding, they have come with heart attacks. So we need to have an open mind whenever we see these patients. And every patient, we have to give a thought that there might be cardiac disease in this patient, so that we can take care in time. Now we all know that this is the structure inside the chest. And this the picture, because if we have to understand about the heart diseases little bit, then we need to understand about the structure of the heart. These blue tubes which are entering into the heart, they basically bring the bad blood or the dirty blood from the body to the heart, and they reach this point. Subsequently, from then this moves. There is another slide where I'll be showing it, that how the blood moves, and ultimately through this one, this is called aorta. The blood goes out of the body out of the heart and is distributed throughout the entire body. Now, next slide. Now, this is a video which shows how the blood flows inside the heart. And if you can see here, this blue blood, which is the dirty blood, which is coming inside the heart. So, upper body, the lower body, it comes into this portion of the heart, and this is right side of the heart. Then from here, this blood goes into the lungs. This is the connection which ultimately is going to the take the blood to the right and the left lung, where the blood gets purified, the oxygen comes in, the carbon dioxide goes out, and the clean blood then enters this aspect of the heart. This is called left atrium, and from left atrium this comes into the left ventricle. Blood comes here, and from here it goes out into the whole body. Now, from the place where it is just starting to go into the aorta and the whole body, from here arises two right and the left arteries. This is another photograph just to highlight the importance. From here, these are the two arteries, the right and the left. The left one divides into the two branches. One goes into the front side of the heart and the other goes to the back side of the heart. So this is a zoomed image which is showing, and if we further zoom and go inside to see what actually lies inside this, then we see that this is a tubular structure. Normally this is the tube is like this. There is a lumen inside which is shown as the blue one where the blood flows, and this is the wall of the artery. Now, whenever the disease of cholesterol deposition or the blockages starts inside the heart, so you can see this yellow thing which is getting deposited here, and the blue inside lumen, the size decreases. And if this process goes further higher up, then we can see that the lumen size is reduced drastically, and we keep seeing these patients coming to our hospital where we see the blockages in the form of 90%, 95%, 99%, sometimes even there's a total occlusion. So this is one thing. And now another thing is about the care. We talk of taking care of the heart today, World Heart Day. So we are discussing all this because we want to take care of our heart. Now, whenever this issue comes about the care, obviously the health becomes one of the key thing which we must understand. The WHO, World Health Organization, they gave a definition that this health, what is health? We all know this person is healthy, this person is not healthy. Those words are always there, but there is a definition to it. And World Health Organization said this health is a state of complete physical, mental, social well-being. So this was one. Then in the broader sense, people have also tried to define it, where it has been said that health is the absence of any disease or impairment in the body. Another definition is health is a state that allows the individual to adequately cope with all demands of daily life, implying also the absence of disease and impairment. And another definition, some people had defined this as health is a state of balance and equilibrium that an individual has established within himself and between himself and his social and physical environment. So these are few definitions of health, and we must understand that health is one aspect of our life which is very important, and health and illness or the disease, they are the two sides of the one coin. If there is absence of health, we find there is a disease. So if we have to achieve a life where there is health, then this almost becomes synonymous that preservation of health is equal to prevention of disease. And when prevention of disease we talk, then there is a whole spectrum, and we must understand that there is a state when the person is absolutely healthy, there is no disease in that particular person. Now if that particular thing is left as such, and if we don't take care of the things, if we don't make efforts to prevent the development of disease, then a lot of time what happens, because of lack of those efforts, the disease starts coming in. So health is a precious God's gift to us, and we must make effort to respect it and preserve it. And so this prevention of disease or the preservation of health. Now, this we categorize into three things: the primary prevention, the secondary, and the tertiary. Primary prevention, what it means is that you take care of the things when you are healthy. You try to prevent the development of the disease process. So, if we look at this slide, so if you see we start from this point, this cholesterol deposition inside the arteries, this starts in the childhood, and then it evolves throughout the lifetime, and there is acceleration in the youth by certain factors. So, and the cardiovascular risk factors evolve over lifespan, and non-uniform of this process is non-uniform. So now this is another picture just to highlight again the same thing, that there is something known as primordial prevention, where is tackling of social determinants of health, like the when you look at the country as a nation, that you make health policies where people remain healthy. So those are the called primordial prevention things. Healthcare financing policies, like for stopping smoking, good dietary habits, physical activity modulation, and improving medical education. And then comes the primary prevention, where you try to prevent. I will be coming to this thing in detail. Then secondary prevention, where we try to treat the disease once it has happened. So there is a primary prevention where we are trying to control the disease when it has not happened. We are trying to prevent the development of disease. Then the next stage comes that the disease has developed in the body, and we manage that thing. And then there is something known as tertiary care. And tertiary is when the disease complications have developed. Person has developed heart attack, his heart has become too weak to carry out the routine things. What we call as a heart failure has there developed. So we make lot of efforts to treat those patients also. So primary prevention, secondary prevention, and tertiary prevention. So this is very important. And now this is one chart where if you just see on the left side, don't go into the other details, but what it shows is the risk factors. The risk factors are, this is apolipoprotein A and B ratio. So this is one of the cholesterol thing in the body, and the ratio of the two things, they are one of the risk factors. Then hypertension, smoking, diabetes, high waist and hip ratio. So the waist should be less, the hips should be slightly more, because the abdominal obesity is a risk factor. Then psychosocial stress. This is another very important factor, that the people who are under constant stress, and which is a very common these days, Even prior to pandemic, this stress was there. Day to day life has become very hectic. There is pressure on everybody to make more money and more money, so and carry out their job profile perfectly. All these things ultimately put lot of mental stress, and we keep seeing younger generation of people coming to the hospital with chest pain, with acute heart attack. And if you try to find out, lot of time you don't get much genetic factors in them. They are not diabetic or high blood pressure, but the stress is there. So stress ultimately produces all these problems. And stress otherwise also it creates problem through different mechanisms also, because a lot of time people who are under stress, they start smoking, the blood pressure start rising, their dietary habits also alter, and sometimes even their blood sugar level also goes up and they become diabetic. So that's the psychological aspect is very important. And absence of good physical exercise is another very important thing. That's the sedentary lifestyle where you don't do any exercise. So that's another very important thing, and every one of us must understand that this is a very important price that we have to pay to have good health. Another thing is diet and lack of alcohol intake. So, and cardiac causes, obviously. So, these are some of the risk factors, and about which we'll be talking. Now, this is another thing that I want to highlight here, that there are certain people who are not diabetic, who are not high blood pressure patient, who don't have any diagnose or standard disease process in them, but they are away from the normal. Their weight is slightly on the higher side, their abdominal obesity is there, and if you look inside, you will find that their insulin level is high. And ultimately these are the people who are vulnerable to develop heart disease subsequently. So this is one stage where we can intervene and we can revert things towards a healthy adult. And if we leave it at this point, like if you check the blood sugar, their blood sugar will be slightly on the higher side but not diabetic range. Now if this person start doing the regular exercises, and dietary restriction, this sugar will become normal. So these are the things, and obviously weight reduction, the regular exercise, is stopping of smoking if it's there. These are some of the very important things. So this metabolic syndrome is another very important aspect, and we have to give a lot of importance to it. Now this is about the stress part we were just discussing. That this is the human function curve, and if you see that if the stress is too little, then the human performance is also not optimal. And if the stress is too much, then also there is burnout, there is exhaustion, and there is breakdown subsequently. So if there is a optimum stress, the performance is at the maximum. So some amount of stress performance is better, but absence of total stress is also not good, and too much of stress is also not good. Now, the yoga and the meditation, these are some of the very nicely recommended thing to manage the stress, and these are all known to establish relaxation technique and decrease lipids and stress hormones, and it alters sympathetic tone inside our body, and it reduces the even the cholesterol deposition. Now another aspect which we should today talk about is about the smoking. If you look into the different aspect, because right now the place we live, we are surrounded by majority of healthcare people, we keep seeing the bad effect of smoking. So you will find very rarely somebody is smoking. And like if I look at my colleagues and my friend circle, I'll not find many people smoking, but that's not everywhere. There are people who continue to smoke in spite of knowing. And we must understand, smoking is not just bad for your heart, it is bad for almost lot of aspects of this. There are known carcinogens. The smoking is known as one of the commonest reason for producing the cancer inside the body. Then the people who have got acid in their stomach, this acid peptic disorder, this also keep worsening and it doesn't heal. So that's another problem that comes with smoking. Then high blood pressure. So the high blood pressure keeps worsening. Another aspect is atherosclerosis, this cholesterol deposition in heart arteries, in the brain arteries. So this all goes in that way. Then this bronchitis is there because of smoking, and there are a couple of things. And in the starting phase of life, you don't actually see the bad aspects, bad effects of the smoking. But this the lung, which every time you smoke, the smoke goes inside at a very high temperature. It damages the lung from inside, and lungs slowly and slowly they keep getting bad. The good thing about the lungs is that even if you remove one lung of the person can live without any problem. So slowly, slowly the lungs are getting damaged. Almost both of these lungs get to around 50% of the disease process, and you still don't have any problem. So when it crosses that level, that's the stage when people start feeling shortness of breath, and that is very late in the course, and it is invariably irreversible. So if anything has to be done, it has to be done when you are fine. And obviously, one of the very important risk factor for coronary artery disease is, and the brain stroke, is smoking. And it is very difficult to convince people to stop smoking. But if you happen to visit the hospital, if you see the patients who suffer because of this, then you might stop smoking. Then exercise is another very important thing, and there is a rule of 4, easy to remember, that we one should walk around 4 kilometer, and that 4 kilometer should be covered in 40 minutes. And what is recommended that you divide this 40 minutes into three parts. First 10 minutes, in between 20 minutes, and end 10 minutes. First 10 minutes you build up your speed, and in the middle for 20 minutes you maintain that high speed, and then you decelerate in the last 10 minutes and you slow down, and you should be able to cover a distance of 4 kilometer in that 4. And if you do that much exercise 4 times a week, that's good enough. And the another thing is very important, that you don't start doing the whole thing day one. You have to start doing this thing gradually build it up. So day one you will be doing like 10-15 minutes of regular walk, not going very fast, so that your body don't get exhausted on day one or day two. Initially just start, so that you are able to take out time for yourself, make changes in your schedule, and go out. Stay there for some time, because ultimately it is going to be 40 minutes of walk, so roughly you will be needing around 50 minutes to be out there. So slowly you have to do, and ultimately when you achieve this target, maintain it. Take off at least 2 or 3 days in a week. 4 days is good enough for the heart. If you want to reduce your weight, again, this walking exercise is very good, but there you might need little more walking. So jogging or running is not that much preferred. What we as cardiologists recommend, as a doctor, we recommend that you should try to walk And there is a word which is walk and jogging in between the two. So it's called jog, where you walk as your speed is very fast. You are almost close to jogging. And running is not recommended because running ultimately puts pressure on your knees, and there is a possibility that you may damage your knees. Swimming is another very good exercise. Then aerobic exercises and cycling. These are some of the recommended exercises. Then diet is the reduce fats and oils and increase complex carbohydrates. The complex carbohydrate means the sugary things which don't taste actually sweet. So they are complex when because it's part of your diet also. You have to take the sugars. So when you like the roti, the rice, all these things have got a lot of carbohydrates in them. When you take them, there are these large complex molecules. So the small parts are broken down and then they are absorbed. So over next 2-3 hours after you're eating them, sugars are slowly digested and then they are absorbed into the blood. And as a result, your blood sugar don't rise very much. And if you eat very sugary thing, very sweet things, then your sugar goes high up, and body is not able to handle that high sugar levels. So it is better to avoid obviously the sweet things. Then high fiber diet is another thing which is preferred, and salt intake also needs to be an appropriate amount. This is another way to just show how much diet and what you should consume in more amount and what should you should consume in moderation. Now, so we have just now covered the one aspect of the primary prevention, where we discussed about that we should have a stress-free life. You should have exercise, you should have yoga, you should have a good dietary habit, you should stop smoking. And if somebody has got high blood pressure, that high blood pressure is also a risk factor and it should be controlled. If somebody is diabetic, the diabetes has to be controlled appropriately. If somebody is overweight, weight has to be reduced. If there is high cholesterol, that also has to be taken care of. And I have got a lot of WhatsApp messages from a lot of friends over last 1 or 2 years, where they have sent me that cholesterol is no more a culprit and it has been taken off and something. But as a cardiologist, as a doctor, we continue to address, and the American Heart Association also they have come up with the recommendations where we continue to take care of the lipids, and we all believe that this is one of the reasons for development of the blockages in the arteries of the heart. So just believing that cholesterol or eating fat is healthy and it doesn't affect anything is not the right thing. Now, coming to the second stage, where person has developed the disease and we have to take care of it. Now, coronary artery disease is like I have shown you that in the heart there are arteries which are called coronary arteries, and the disease where the blockage develop in them. So these patients, they are either majority of them are asymptomatic. The disease process, a lot of time it start from the childhood. Slowly, the blockages are developing inside the arteries, and as long as these blockages have not reached a certain critical stage, and which is usually considered to be 70%, they will not have much symptoms. And so these patients continue to be asymptomatic. And once the blockage cross that particular mark, then they start complaining of chest pain when they will walk beyond certain level, or they are climbing stairs, or they are lifting heavy weight and they are like suitcase or they are walking uphill, or they are walking against a breeze, or if the weather is very cold and they are walking in cold. So all these things, they precipitate an attack of angina. They complained of chest pain. So the chest pain which is coming from the heart because of decreased blood supply is called as angina. And then we all know there is something known as acute heart attack. So that's a small number of patients who, out of the whole sea of these coronary artery disease patients, only few get acute heart attack. Majority of them will get angina, and even bigger number will have just asymptomatic status. So now the question comes: how do a normal person knows that he has got a heart disease or he does not have a heart disease? So what is the way forward to find out if the person has got, and if like this is one picture which is showing about the angina. This is typical site where you get the pain. You can see this pain is radiating to the left arm. So the pain is usually described as either somewhere in the center of the chest, inside the chest, left side predominantly, sometimes in upper abdomen, sometimes it goes to the jaw also, then it radiates to the arm also. So sometimes there is a pain in the tooth, especially the left side. So these are all different presentation, and some people don't get chest pain, they just get shortness of breath when they walk. So that's called angina equivalent. So that's one thing. And when we see these patients with heart attack, they also complain of chest pain. This is typically centralized chest pain, and they usually come with lot of sweating. The pain starts, angina pain usually start, and when you stop walking or doing exertion, the pain subsides. But in the heart attack, the pain keeps going on unless it is intervened by the doctors. Now the question comes: how do we actually make a diagnosis whether the person has got a heart disease or not? So for there are definite guidelines that what age group, how you are going to proceed, and your suspicion in which patients you are going to think that there is a heart problem or in certain age group. So, and especially this asymptomatic people who don't have got any chest pain, any problem, they are the ones where preventive health checkup is something that has come up, where we test these people for the routine things, the routine risk factors which I told you earlier, and we try to correct them. If there is there has to be a meeting between the doctor and the healthy people also. We check for the lipids, we check for the sugar level, we check their blood pressure, we check their weight, and we check their hip waist ratio. There are lots of things which are there. So if any of those things is not in the normal range, then we recommend certain therapeutic management so that the coronary artery disease does not develop in them. And once they are beyond that stage, the disease has developed and the person has got chest pain. So when these patients come to us that there is a chest pain, then obviously we see these patients, we take a history, we try to understand what is the type of chest pain. It's here, it's here. Like a lot of patients these days during this pandemic, they have come to us with pain here because this was the pain that scared them. So they came here. But when we actually examined them and we inquired, so what was happening, they were sitting a lot of time like this and doing some work on their computer, working from home or using mobile lot of times. So constantly there is a stress on this aspect of the neck, and when you touch them there is a spasm in these muscles, and there because of this spasm there is a pain radiating from here. So the problem is not here. Problem is somewhere here in the cervical spine and this area, and this pain is radiating down the left arm. So this left arm is also getting pain. Now, lot of time, and this pain somehow comes to this upper part of the chest also. So once we examine these patients, we know this is not classical angina pain, which is usually here or here, and then it goes inside the arm and towards this small finger. Unlike this patient, this set of patients where you get pain from here, but there may be a coincidence where this is also there and they can actually get a chest pain. So it is always better that when these patients have these problems, they should consult a doctor, and doctor should evaluate for possibility of heart disease in them. So the ECG is done. If ECG can be a normal ECG, or there can be abnormalities in the ECG. So it helps us in a way that if there is abnormality, then we know these are the patients who have developed the disease, and we must go ahead and do next step management. Then there is a treadmill. We do a treadmill exercise test for these patients, and we put the ECG, and there is a constantly monitoring. So we are monitoring these patients, and if like a lot of time at rest, they will not have chest pain. The pain usually comes when they climb stairs or they run. So the same situation is simulated inside the lab where doctor, nurses, and the whole machinery is there, and we are watching everything. So the same environment is created. So a lot of time we are able to find that there is a change in the ECG while the person is running. So that's also an indicator that there is blockage inside the heart, and we should go to the next higher level for their management, which I will tell you subsequently. Then the echo. Echo is a test which is ultrasound of the heart, where we are able to see the whole of the heart, how it functions, different aspects of the functioning, the structural abnormalities. So we lot of time are able to find out exactly what is wrong with the heart, which can give rise to the problem. And lot of other times, like those patients who are asymptomatic, this echo can be normal. So a normal echo, a normal ECG does not mean that everything is fine with the person. We might have to go beyond and find out by other tests. Then there is a nuclear test which is called SPECT or thallium, where a radioactive material is injected inside your body and it goes to the heart and the scanning is done. Whenever we use this nuclear, the people get scared that is there something radioactive material going inside, will it harm? So my normal answer to a lot of people is that don't be scared, because this is one of the commonest tests in the whole United States, Canada, Europe, Australia. So the countries where the healthcare is one of the most advanced, and where patient safety is of utmost importance, there this is one of the first line test which is done to find out whether there is something wrong with the heart. So this test is not to be scared of. And if these tests suggest that there is a possibility of blockage in the arteries which I showed you in the beginning, so we have to do an angiography. And angiography is again, one is to the invasive angiography, which is a normal angiography, and there is a new thing that has come up over last few decades. It's called CT coronary angiography, where you actually don't go inside. You just give an injection of the dye inside your in your hand, and you do scanning of the heart. And it is also known as a virtual angiography, where actually you are not going inside the heart, you are not doing injecting anything, but it will give you almost same information. And CT angio is good, especially if you are thinking that a person will not be having heart disease. Because if you think there is a possibility, a very strong suspicion of a person having heart disease, then conventional angiography has to be done, and then whether you go ahead and put the stent as the next step, so that will be next thing. Then there is a MRI of the heart. Then there is something known as transesophageal echocardiography, where we put a endoscopic thing, what the gastroenterologists usually do to find out the peptic ulcer disease or what is going on wrong inside the stomach. Same instrument with the probe inside is used to see the heart from very close. And then recent advances, the three-dimensional echocardiography has come up that also helps in making the diagnosis. So once we have made the diagnosis with that the person has got coronary artery disease, has got heart attack, has got blockages, then obviously the next step comes is the treatment. Now, when it comes to the treatment of the heart, these patients of the coronary artery disease, there are two different set of patients. One is acute and one is chronic. Acute means that the pain has developed just now, and the chronic means that there is a chronic problem going on for months together, days together, and even years together, and people have been managing themselves with the change in their exercise or exertion level and taking medications. That sometimes helps. And in the acute case, there is acute pain. These patients come to the hospital. Now, acute that artery which I was showing you, if the artery is totally occluded, if it is 100% blocked because of the acute heart attack, then that artery has to be opened up, because the heart attack, the chest pain which we get, this chest pain is an indicator that the blood is not flowing inside the heart, oxygen is not reaching to the heart muscle, and heart muscle is basically crying. That's the cry of the heart muscle because of lack of this nutrition to it is what we call as the chest pain or the angina. Now, this is there is an imbalance between the need of the heart muscle and the supply because of the blockage. And if we don't restore this supply quickly, then the lack of the nutrient supply to the heart muscle will ultimately result in the damage, and the heart muscle will get damaged, and the heart muscle get damaged permanently. It never comes back. So there is a very crucial time when it has to be done. All this has to be done very quickly. So whenever the somebody is has got a chest pain, there is a concept of golden hour, where if possible everything should be done within the first hour, maybe initial few hours. So the person has to be rushed to the place where the heart treatment can be carried out. Lot of time what happens that people are maybe traveling or they are somewhere away, and they know, like we are in Delhi, sometimes people call us from nearby a small town that their patient has got chest pain, and there is a the doctor has seen, and they are saying that angiography has to be done and they have to do a stent thing. Now, if there is an acute MI, then wherever you are, wherever the person is, that thing has to be taken care of as soon as possible. Don't stop them from putting in the stent in acute MI that no, don't want to get the treatment here. Delhi, we will go to Delhi or a bigger city and we'll get the best treatment. Because if you stop the doctor there and you lose that golden hour, then the heart muscle will get damaged, and it will get damaged permanently. Now, this is one graph where you can see in the there are ECG, like the first one is showing that the person is there, chest pain is there, and the third last picture which is showing a person lying down. even if there is a total occlusion of the heart muscle, or even sometimes it's not total occlusion, but even then person can get a shock, and some people die also, sudden cardiac death it is called. And there can be ECG changes, and then we do blood testing which can also be shown to help to make the diagnosis. And then the spectrum that I was telling you, that the people can have a full blown heart attack, minor heart attack, just angina, or there can be non cardiac pain. So this heart, this golden hour, time as muscle, golden hour is a window of opportunity that impacts a patient's survival and quality of life following the heart attack. So this is very important that and if you see, this is a graph which is showing that the time to treatment and 1 year mortality. If you see in this, this is the scale, like the time person gets chest pain. So as the time increases, this is 1 hour, 2 hour, 3 hour, 4 hour, 5 hour, 6 hour. The people surviving at the end of the 1 year, they that number keeps less. So more and more people will die if the treatment is not done within that initial time. And if these patients are given the, if there is no treatment given, then what we see that more and more people don't survive. But if you this something which is called as pre-hospital thrombolysis, which is still not practiced in our country, but in hospital thrombolysis and primary angioplasty is done. So these two graphs, they are almost equally good. And if you see this difference, these are the patients who have not got any treatment, these are the patients who have got the treatment. So there is a definite change, and there is a lot of research that has gone into this. And then this conclusion was drawn that the treatment of heart attack is an acute phase is very important. Then there are drugs which are have to be given to these patients, and oxygen sorbitrate is there, everybody knows. Then there is a something known as morphine which is given to relieve the pain if the pain is very severe. Then there are other drugs which we give to these patients. And now if you come to the non-acute phase, then these patients can be offered medical treatment. There can be angioplasty, there can be bypass surgery, and there is something known as EECP, which is one of the modality of treatment for those patients where angioplasty or CABG cannot be done, and they still have chest pain in spite of giving them optimal drug therapy. Now this is a photograph on the angiography where there is a blockage in the LED artery. You can see there is a blockage out there. And this is a video just showing that this is the yellow thing. You can see there is a cholesterol deposition. When we do the angioplasty, this is first the wire goes through, then this another thing which is known as balloon, this comes in, and we inflate this balloon. So this is known as ballooning. So the balloon has pushed this cholesterol to the side walls, and the opening has become little bigger. So repeatedly we inflate this balloon out there, and slowly this opening inside the artery, which was earlier quite significantly blocked, ultimately becomes little better. Then if you see, the same wire is there, and this mesh which is known as stent. So this is then placed out there, and there is a balloon inside again, and that balloon inflates, and this mesh is also inflated, and then the balloon is deflated, but this mesh thing will stay there, and the whole thing is taken out. So that way we are able to take care of the blockages inside the artery. This is another picture just to show the same thing. There is a cholesterol deposition here. This is the whole thing across it, and this balloon is inflated, and over it is the stent, which is also inflated, and then everything is removed. Thus, the stent remains there. Another modality of treatment for these patients is cardiac surgery, where we put a conduit. We take this from the person's body, some of the either the veins or the arteries, and we stitch them at, like, if this artery is blocked, you can see this is a blocked artery. We have taken another artery and we stitch it here and we stitch it here, so that this block which was there is bypassed, and this surgery is then called as bypass. This is shown in the blue color. This is a vein which is taken from the patient's leg, and again this is a stitch at one point here and one point here. So if there was a blockage here, this is again bypassed. So this is the surgery. This is bigger part of the treatment. The whole chest is cut from the center. This is opened up, and we can see the heart, and all this is done in direct vision. And then this is these days surgery is almost done in majority of big cities, and people are coming regularly. But when we are talking of the surgery, we must understand and remember that the surgery, the angioplasty, every modality of treatment comes with some risk. It's not that everybody who goes in will come out of it. There are certain people who gets complications, and some people don't make it also, although that number is very small in um, like for a bypass surgery it's just 2% mortality. But now once we have reached to this point, and if you go back to my initial slides where we were talking of the prevention, so now we understand that it is very, very important that we try to understand about the preventive aspect and focus. Now, this was about the tertiary thing, that once the patient has got heart attack, the heart has become too weak, there are complications. So we manage those complications also. That's called tertiary care. And if you see this ABC of preventive cardiology, then we aspirin is one thing, blood pressure management, cholesterol management, diabetes management, exercise regularly, food modulation and smoking cessation, the weight and the truncal obesity control, and high alcohol intake control. So if there is irregular pulse, that has to be taken care of. So these are a lot of things which I wanted to discuss with you people and make you aware. Now, at this point of time, I would like to have interaction with you people, and I will be happy to take questions. Just give me a second. Okay, I'm okay. I'm just now looking at the questions, and one by one, I'll just read them out and try to answer you. Now, this Krishna Baiju, uh, you have asked this question that the pulse is constantly above 100. Is it a symptom of heart disease? Now, the high pulse rate is there because of lot of reasons, and whenever it is there, because I think these days we are getting a lot of people complaining of this high pulse rate, and one of the, I think, key reason why this is happening is that because of this pandemic, this pulse oximeter has become very popular, and everybody has got this pulse oximeter, so they check their pulse. And so when they are checking pulse, there is a lot of anxiety, and anxiety increases your pulse rate also. So it is very important that the person who is testing your pulse knows how to do that part, because you have to be relaxed, you have to mentally relax absolutely. And if in spite of that thing, if the pulse rate is high, then obviously there are other assessment which we do, like we do a ECG, sometimes we do a echo also. Then thyroid also can result in somebody's pulse being high. And then there are situations, if the hemoglobin is low, that person can also have high pulse. So there are a couple of things, and it's not a very straightforward thing that the high pulse will always mean a heart problem. It may be there, it may not be there. It has to be evaluated. Now, this is Naveen. This question about any recommended exercise and diet for asthma patient. Now, whatever exercises, and because asthma patient, if you start doing the exercise when your asthma is not settled, then obviously it is going to give problem. So the first thing first, the asthma has to be appropriately controlled with the drug advice from your doctor. And once we know that the asthma is appropriately controlled, then we can definitely should go for exercise, and there should not be any limiting this limiting breathlessness or the asthma there to put limit to your exercise. And obviously it's the same sort of exercises. We don't recommend very rigorous exercise, but the exercise where you gradually build up, go to a certain level, then again go for the relaxation. But asthma has to be appropriately controlled, and there are medicines available, and all the pulmonologists, even the pediatric doctors and the physicians, they all are trying to treat these patients. A lot of time we get a combination of patients where they have got heart disease, they have got asthma, and so we have to treat both of these things judiciously. And once their breathlessness is appropriately controlled, we put them on exercise protocol also, and slowly we build them up their exercise tolerance, and they are able to carry on their routine activity. Now, next question: what test required to confirm is it a healthy bradycardia or there is really a problem, and it is with irregular heartbeat? Now, bradycardia means the pulse rate is less. Normally, adult people will have a pulse rate between 50 to 100, and majority of adults usually it is 60 to 90. So beyond 50 and beyond above 100 is definitely abnormal. Now, if you are saying that bradycardia, if the pulse rate is less than 50, now there are healthy people who can have less than 50 pulse rate, and there are disease condition where the pulse rate will be low. So we always start with a healthy, like a trained athlete will have low pulse rate. And while people are sleeping, there that time also the pulse rate is low. Then the third thing is that if there is a hypothyroidism, where the thyroid level is very low, those people can also have low pulse rate. So if we really want to know what is wrong, then we must get an ECG done. Another thing is known as Holter, where we put this thing on to your chest. Inside, it's a small device. It is hung from your neck. It remains inside your whatever you are wearing up there, and it keeps recording 24 hours your ECG. And then you return it next day. We put it in the computer, and we get to see what was your pulse rate when you were awake, what was your pulse rate when you were sleeping. Another way of finding out whether this pulse rate is low and it's wrong, besides the ECG and the other thing, is when you are doing exercise. That time the pulse rate should go higher up, and on your good exercise there is something known as the target heart rate for every age group. So there is a number of 220. If you minus 220 your age, if somebody is like 20 years of age, so 220 minus 20 is 200. So a person when doing exercise should be able to cross the 85% mark of this 200, and 85% means around 170. So with maximum exercise, person should be able to reach a level heart rate of 170, even if his heart rate resting is just 50. So this is all the things we keep doing. It's not just that you can do it at home. We do while doing the treadmill. Sometimes we do treadmill test only to establish that the slow pulse rate is there only at rest. Okay, so what can be done for enlarged heart due to high blood pressure? What kind of amount of exercise is safe? Can the heart go back to normal size? Now, there are two different things when you have asked this question. High blood pressure usually results in the thickening of the heart muscle. And if like this is the heart, then or like if this is the heart, this is the cavity of the heart, and this is the muscle, heart muscle, which is this thick. Normally what happens when the high blood pressure is there, the thickening is inside and the cavity becomes smaller, and this is something we call as left ventricular hypertrophy. So as long as this high blood pressure is there, that stress is there, these people will have thickened heart. On the echocardiography we can see this thing. X-ray may not be able to show this, but this thing will be there on the echocardiography. And if we control the high blood pressure appropriately, and then there are a certain class of drugs which are known to decrease this hypertrophy. Not extent, but to some extent, definitely the hypertrophy reduces with adequate control of the blood pressure. Then there is something known as end stage heart high blood pressure disease, where blood pressure has been there for a very long time and heart starts failing to pump against that high blood pressure. And there the heart starts dilating and it becomes weak. So to a certain time, heart it becomes even stronger in high blood pressure. But this the different condition where the heart gives up and it becomes dilated. So there it's a very end stage, and again we have to treat these patients with drugs, and whatever size is there with appropriate therapy, size gets reduced, not exactly back to normal, but slight towards the normal. What are the precautions to be taken after a bypass surgery? Okay, now bypass surgery means that the person had lot of blockages in his heart, which were not, which were so much that even stent putting was not possible, or it was blockages at multiple sites. So, if somebody has got that much disease and he's undergone bypass surgery, then if you just recollect my beginning thing, few slides where I was talking about the preventive aspect, that this person has got a tendency for the development of the blockages. So all those risk factors, smoking, obesity, diabetes, high blood pressure, lack of exercise, too much intake of oxygen, this alcohol, stress, all these things have to be given lot of importance and they have to be taken care of. Obviously, the medications advised for the prevention of blockages, again, they have to be continued along with this. And during the early time of the bypass, this scar which is there, it takes time to heal, so not much turning around and putting pressure on this area has to be there. Cautious. Okay, then resting heart rate is 45 before leaving bed. Is it bradycardia if it remains 55 to 60 during the day? I think I have answered this question, that lying down pulse rate may be low, but this scenario needs to be evaluated because the low thyroid level has to be ruled out in this scenario. And once there is something known as chronotropic incompetence, that because actually what happens when we do like at the resting condition, our body requires certain amount of blood for its normal functioning. Heart is a basically a pump, so there is a measure, like heart beats almost 70 times a minute, and each time it pumps roughly 70 ml of blood goes out. So if you multiply this two numbers, we get the output of the heart over a minute. So that's roughly 5 liters for every minute. Now if the pulse rate goes down, so the heart has to start pumping more with each beat, and if it is not able to do so, then the person will have problems. So we must find out that what is happening to this particular scenario when you are doing exercise. If at exercise your heart rate is going up to a appropriate level, then there is no problem. But the ECG has to be done, echo has to be done, these basic tests should be carried out. Now this is uh, Amulya has asked this question, that how do we know whether it is gastric pain or cardiac pain? Now, like, uh, let me just put this the other way. If somebody has got a complaint, because a lot of time the gastric pain is here in the stomach region, then sometimes you can, because this food pipe is there, sometimes there is a reflux, so that you can, a person can get a heartburn inside this area. Sometimes even there is a gaseous distension of the abdomen and person can have a discomfort in the chest area. So the discomfort area is overlapping for the cardiac as well as the gastric thing. And another thing is that if somebody has got a gastric problem and it is ignored, then not much damage is going to be there. Subsequently, you may will feel it, and then you can get the treatment later on. But if it is a heart problem, if it is angina, or if it is a heart attack, and you start believing that this is gastritis or gastric, then that golden hour that I talked to you about, that golden time will be lost, heart will be damaged permanently. We keep seeing patients that the patient gives a history that yesterday I had this gases and I took a limca and then I get burps and then the whole thing was relieved. And you do their echo and the ECG, you find a full blown heart attack. So it is always better that if you are getting some symptoms where there is a confusion whether it's heart problem or it's a gastric problem, it is always advisable to go to a doctor and let the doctor decide whether it is this or it is that. Please tell me about PVR replacement for TOF patients. Okay. These TOF patients, these are the congenital heart disease patients where there is a corrective surgery, and just the PVR is not the whole thing. There's a lot of things. There is a hole inside the heart. There is a malplacement of the outlets, the structure that I have shown you. So individually, the every time, because and subsequent to the basic surgery of these TOF patients, they a lot of time develop this pulmonary valve regurgitation later in their life, and this pulmonary valve is required to be replaced at certain time in their life. So that's one of the things, and again that's a very specific situation which we deal with whenever such situation comes. I'm happy to have answered almost all the questions, and if there is I'll share my email contact also with you people, and if there is any query from you people subsequently also, I'll be happy to answer them. I believe this is done on my part. So I think we have reached to this end of this session, and I hope this information will help you people live a better life. And all my good wishes to all of you, your families, your loved ones. Thank you.